You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering liposuction. With us, we have an expert on the topic. In fact, he has created a technique for it called the Changes Rapid Lipo. With us, we have board-certified plastic surgeon, Dr. Gilbert Lee. Dr. Lee, welcome to the program.
Thanks, Randy. I'm anxious to be here.
Now, we had you in the program talking about the keys to a natural-looking facelift.
Yes.
But lipo is a big part of your practice, too. Is that right?
I love doing lipo. It's funny because a lot of surgeons don't like doing lipo. I love doing lipo.
Yeah, that's right. People will tell me, I don't want to be doing lipo all day.
You know, when we're trained, we're kind of trained to go in there and just remove fat. And if you look at it that way, it can be boring and it's just very one-dimensional. But that would be kind of like the artisan telling Michelangelo, here's a huge piece of marble, go in there and remove as much marble as you can. You don't sculpt David that way. It's important to shape, and what you leave is just as important as what you take.
Is that right? So there is an artistic
absolutely. Yeah.
part of this.
Yeah.
Now, for people that don't know you, I know you have a great reputation in here in San Diego, and people need to know it's a real interview. I'm not endorsing you or siding with you, but you've been out here for about 20 years.
Right.
Doing plastic surgery.
Yeah, I love it. San Diego's my hometown, and we have a comprehensive plastic surgery
So you do everything
practice.
there. Tell us about the practice.
We operate from head to toe, but I love doing lipo because it so changes people's lives. You know, it's really powerful when somebody who puts on their clothes and always feels just a little insecure about this one facet. If we can take that away, do you know how much that changes their life?
Do you have people tell you that?
Oh my gosh! I'll give you an example. A patient, she is an avid gym rat, and every time she wears her workout outfit, that sports bra, she has the rolls of the back fat. It sticks out, it drives her nuts. Gone in about an hour.
Is that right? Now, you do lipo. I guess most of the time when you do lipo, I mean, you do it differently. Tell me about that.
Well, I think there's many different ways to do lipo that people have heard of, and primarily there's general anesthesia, there's local anesthesia. And one of the things with local anesthesia is sometimes you're more limited by the result. What's neat about the Changes Rapid Lipo is that we can now do lipo under local anesthesia.
So they're somewhat awake?
Yeah.
Okay.
We're talking, we're chatting. It's actually a fun experience. It's done under local anesthesia. We can do a very thorough job and get a beautiful result, and it's a much smoother patient experience. And there's a trick to that. It's the new vibro lipo technique. So the actual machine and cannula vibrate. And there's this interesting neurologic thing called the gate system, where the nerves that carry pain and the nerves that carry vibration are one and the same. So with this vibrating liposuction cannula, if you overwhelm the nerve with vibration, you don't feel any discomfort. So it's
interesting.
It's really
there was a video that we were gonna have on the show, and we because of the graphic nature we couldn't show it. But I guess the patient's kind of giggling a little bit.
Yeah. So we got the machine,
the
and we of course lined up the usual suspects. So it's a clip, and you can go and see it on YouTube. But it's of me doing lipo on my staff member Michelle, and as we're doing her lipo, we're chatting, and we were doing it on late on a Friday, and as I would get up to her ribs, it actually tickles, and she would be laughing hysterically through the liposuction procedure.
But does it allow you to maybe sometimes get more aggressive because you have more time on your hands?
Well, I don't usually use aggressive and liposuction in the same sentence, but it does allow me to be thorough in terms of where we're going. One of the limiting areas is fibrous areas, because liposuction's tough in fibrous areas like the back or breasts or even the abdomen. And with the vibro technique, it just wiggles its way right through those fibrous areas, and you can get a much smoother and even result with a lot more patient comfort.
Okay, so let's start from the most common area. What's the #1 area that you do in your practice?
Depends if it's men or women.
For women.
Okay, so the predominant body type for women would be the pear shape. So these women can often look completely skinny on the top, but as you get towards the waistline, they start to, if they're going to put on weight, it's usually below the weight. So that in the pear-shaped women, thighs and hips are probably the #1 area. The other common body type would be what we call the apple body type, which for them, they tend to have skinny arms and legs, and if they're going to gain weight, they tend to gain it in the core. Okay. So those are predominantly the female body shapes that we see. For men, it's a little different.
You think and I'm going to quote you exactly, you say every man over 40 or 30 should get liposuction, or needs liposuction.
I stand by that statement. I stand by that
every
statement.
Man.
You show me a guy over 30 that doesn't need a little lipo. And I say it tongue in cheek, but let me explain what I mean. Male pattern of fat accumulation is predominantly around the midsection.
Okay.
Sometimes as you get older, you get it in your breasts. That's kind of disconcerting when you get around 40 or 50. But when does this fat accumulation around the waist occur? Well, usually right around the age of 30, you start to see the signs.
Are you seeing more of it because we're all working on computers now? More and more sitting than ever before.
You know, I think I see more of it because we're in California and people spend more time in their workout clothes or at the beach or riding their bikes. And so in California, we see a lot of that. But I want to show you a picture, if I could, of what I mean by most men over 30 need liposuction.
All right.
Here's a photo of a very young male, right around 30 years of age. Now, this fellow works out.
Not so bad.
Yeah, but Randy, to him, here's the thing. He's in great shape. He feels really good about himself. But when he takes his shirt off at the pool, he is really sensitive about the love handles. Okay. And almost every male over 30 has this to some degree. And wouldn't it be cool if in about an hour they were gone?
All right.
That would be cool, right?
Okay, so everybody needs lipo. I need lipo. Everybody needs lipo.
Randy, I've had lipo.
Over 30, okay.
I'm not overweight, but I had that done. Okay. And I want to show
Very nice result.
I want to show you that. Look at that. Now, that's a silhouette you can be proud of. And you know what? He's stoked. He goes to the gym. He works out without a shirt on, and he feels really comfortable. You don't have... he can wear whatever pants and shorts he wants, and he doesn't have that little spillover.
So what are the age ranges of men, then, that are coming in?
Oh, I would say anywhere from 20 to 65.
So 65-year-olds are coming in for lipo?
Yeah, absolutely. You can do lipo all the way up to about 65, but ideally, I'd like to catch the patients earlier because the best results are achieved when the skin has a lot of elasticity, and that elasticity allows us to get an even leaner, smoother result.
Okay, good. Now, for men, the breasts on men, I went to your website, by the way, very impressive.
Well, thanks.
With the male, because I look at a lot of websites of doctors, and yours were very good.
Yeah.
Tell me about the technique there.
Well, I would say that male breasts can occur even in as young as an 18-year-old. I've seen a 16-year-old have it, and it is so self-conscious. I mean, it's a life impediment for a youthful male to have that. It's really troublesome, and they'll come in with their parents and just go, you know what, I don't want to shower at the gym. I don't want to take my shirt off. I don't want to.
People make fun of them probably too.
They make fun of them.
Their buddies or whatever.
Yeah, and they don't want to go to parties, and it's life changing. I'll show you a picture of that.
Okay, and the downtime for a man is not long, right?
No.
Just wrap the chest. I mean, they could go on a Friday with the man boobs, and on Monday they're fine. Is that right?
Well, yeah. I mean, they're out and about, certainly. They're out and about that weekend. It does take about 3 weeks to recover. But
guys are going back to work, right?
Oh, yeah, for sure. But can you imagine being 18 years old
that's too bad.
and just feeling very self-conscious about going out? For this young man, that was life-changing.
Yeah, it's gone.
Yeah, and I'll show you another one.
So they could wear a T-shirt, and it like on this poor guy with a T-shirt would have been rough.
Right. You wear a clingy workout shirt, and your nipples are showing through. So same thing. This is a young male. He's in his late 20s, bothered by it. When he was in college, his fraternity brothers used to rag on him, and he's a happy-go-lucky guy. He didn't let it get to him. He came to me when he was 28, and he says, you know what? it got to me. It really bothered me. And he wrote me the nicest thank you letter when it was done. He said, I didn't realize how much it bothered me, but this has really changed my life.
So this is kind of a quick fix, and they won't come back, right? Those fat cells, they're gone.
They're gone. They're gone. That's the beauty, is you have the opportunity to change your legacy. This is one of the few times in life where you can change your legacy. Okay. If you were always destined, I want to show you something. If you were always destined to have your mother's thighs, now's your opportunity to change. So let's move back to women for a second. So you see in that before, this woman has
she's in great shape.
She's in great shape. She's got such a tiny waist, beautiful face, a nice skinny arm. She's in wonderful shape. But she said, you know what? I work out like a fiend. You know why? Because I don't want my mother's body. And you know what? It doesn't matter how hard she works out. She's starting to see it. It's subtle, Randy. I want you to look at her inner thighs and her outer thighs. And she's in great shape, but it's starting to come. When she wears a nice clingy dress, she can see those little hip corners poking out. And when she wears a certain type of jeans, she feels her thighs rubbing together, and it really bothers her. So we can erase those. And I want you to look at the after now. This is an hour and a half later. Obviously she's healed, but in an hour and a half of a procedure, we've now trimmed down the thighs. Now look at the outer.
So that little saddlebag area on the before and after, yeah, it's gone.
Right. And we do this under local anesthesia. We're chatting the whole time. We're listening to tunes. I like to play music trivia while we're working. And now her thighs don't touch. And in a dress, she looks unbelievable.
So what's the advantage, though? You do it under local, right, where they're somewhat awake, over general anesthesia. What's the advantage? Or why do some plastic surgeons do it one way and the other way?
Well, from the plastic surgeon standpoint, doing it under general anesthesia is much easier. But from the patient's standpoint, you do it under local, it is such a smooth experience. You get to walk in, you get to walk out, you don't have any recovery, there's no after effects from anesthesia. It's a much quicker, easier, simplified procedure. But during the procedure, what we're allowed to do now under local anesthesia with the changes rapid lipo and the vibro-lipo system is we can get very, very precise, and we don't compromise the quality by doing it under local. That was one of the limitations of local in the past, is that the quality of your result and the precision of your result was somewhat limited by patient comfort. And now those are no longer issues. We can get fantastic results.
So with thighs, okay, and back to like this photo. So are you going all the way around?
Right, yes. But here's what's really important, Randy, is that when you have a young, beautiful woman like this with otherwise perfect skin and thighs, you can't leave a little dent. You leave a dent, and that's totally visible when she wears her bathing suit. I want to make sure that's smooth all the way around. So I really get down and I lean and look, and it's like I study the contours and with the lighting to make sure that I get as smooth a result as possible.
Are you a lipo fanatic?
I'm kind of a
perfectionist?
Yeah, it's a disease.
So what's the easiest area for you to treat?
Well,
or that you enjoy the most?
I would say the easiest area to treat is the thighs, because they represent a very finite area to, it's a very localized problem, and we can just balance it with the rest of the beautiful thigh skin. Let me show you a couple examples here, Randy. Here's another patient. She has a typical pear-shaped body, you can see in the before, and we're able to just reshape her so she feels so much more confident.
Wow, I mean, her legs look a lot thinner in the after. Well, she must have also had some weight loss as well.
You know what?
On her own.
She did not
That's all lipo?
She did not lose a single pound except for what we removed. And especially look at her left thigh. You can just see quite a bit of difference in the contour.
That is a big difference on the
before
and after.
This is another thing. We want to maintain the beautiful taper of the thigh. So you don't want to have stick legs when you're done. It's not about removing all the fat. It's about what you leave behind for the feminine curves. Now here's another woman, Randy. She's in great shape, and she's really bothered by those inner thighs. She can go to the gym and do as many of these exercises as she wants, but she just can't treat the fat.
So just born with, genetically has extra fat there.
Absolutely. So what I did with her is we stand together in the mirror, and I show them a vision of what they can look like. And I use my hands, and we'll stand in the mirror, and I say, now what do you think about this contour to your waistline? would you like more of the hourglass shape? So I want you to look at the subtlety of this before picture and notice at her waistline, there's kind of a squarishness.
Like a blocky. Interesting.
A little bit blocky, but most people won't catch that. But now I want to show you the after. Take a look at the after, and let's just look at her waistline. Do you see how just that subtlety in her waistline makes all the difference when you're wearing a tight evening gown? You get that beautiful, from behind, there's nothing sexier than this part of a woman. I love it.
Okay.
You take a look, and I in a bathing suit, she'll look fabulous as well.
When they come back, by the way, you say that they change. But sometimes lipo's leverage to take care of themselves.
The self-confidence,
or get on a diet or whatever.
The self-confidence boost you see is amazing. There's a little perk to their step. You'll see it. I see it every day. It's really neat. And if you look at the inner and outer thighs, you can see her thighs don't touch anymore when she walks, and outward wise, where the saddlebags were in the afterwards, you don't see them anymore.
Okay, so lipo. And men, you have some men photos
yes,
there
so,
too?
Randy, here's another patient. I just want you to look, remember I talked about how I look at different angles? I want you to look at this oblique angle and look at the back of the waistline. You see in the before how there's that little bulge there? We see people from 360 degrees. It's not just important to look good from this view, because there's always somebody over here looking at you from another angle, right?
Okay.
So we go all the way around that waistline to get rid of that little bump to make sure that from every view they look impeccable. Here's another one, just so you can drive home that point. Another athletic male. Every male over 30 is a candidate.
And because it looks like weight loss combined with it.
So that's a really interesting thing. In order, this gentleman could lose 40 pounds and he would still have a little bit of bulging there. Okay. So it is as if they've lost 15 pounds, but we really have only taken off maybe 1 or 2 pounds.
So they're tucking in their shirts?
They're tucking in their
feeling
shirts.
Good.
And more importantly, they're taking their shirts off, because if you can have a waistline like that, why wouldn't you?
So what are other areas of the body you're doing?
Well, women have little problem spots, and they really are bothered by them. And this is one of my favorite areas to treat, because I feel like I'm really good at it. This is the bra line area. And men can't relate, but women are incredibly bugged by this area, because if they wear something elegant, there's nothing, I hear this all the time, Randy, there's nothing worse than being all dressed up in a cocktail dress and then at the final step having to tuck your fat into your dress.
Did they tell you that?
They tell me that, and I feel terrible. And I'm happy to say there's a treatment. And so what we do is we go from the backside right through the bra line, just 3 little poke holes. They heal beautifully, and you know what? The back fat's gone.
Is this one of those things, again, the downtime?
Yeah, so the downtime with this is, I mean, you're up and about that
But they
same
can go to
day.
work. I mean, do you have people that go to work the next day?
Yeah, some people can go back to work the very next day. You're going to be a little sore, but it's very doable.
So it seems like a lot of fat and also very smooth results.
Yeah,
is it tedious work?
It's meticulous work. And so to get a smooth result, you have to be doing this, you know, we're crisscrossing. Every place we go, it's in multi-planes and it's crisscrossing, so it's multi-dimensional. So we don't leave any area that's over or under treated. It's got to be smooth. You've got to hit this right on the head or it's visible. And I am all about keeping that smooth. How much do we remove? Sometimes we remove 1 liter from each area. Can you imagine walking around with two 2-liter Coke bottles in your
Is that right?
in your shirt? Yeah, so we can remove a lot. And this system allows us to remove efficiently, smoothly, and with a really nice patient experience.
Now, for people just tuning in, we're here with Dr. Gilbert Lee. We're talking about liposuction, the new liposuction, which it's a vibration technique.
Right.
Tell me about that, for people just tuning in.
So what we have is, it's called the vibro-lipo technique, and it's a vibrating cannula which tricks the nervous system into feeling vibration so you don't feel discomfort. And it's because it separates the fibrous tissues from the fat, it allows us to extract fat at a much faster rate than previous systems. We're up to 42% faster.
Okay, good. So they're wearing tighter clothing. They come in skin-type tops sometime when it's all done?
Randy, can you imagine if this patient, I'm just going to show you again, can you imagine if this patient we're wearing a black evening gown, how much more confident she'll feel
yeah,
seeing
looks
the back fat rolls. It's life changing. I love it. Another area patients always complain about, or frequently, is the back of the arms. They say they don't feel athletic. Often they say that they feel like their arms kind of look like their mother's arms.
Okay.
And if this was your legacy, well, we have a solution to change that.
Okay.
So that's a typical patient that she just feels a little heaviness under her arms, particularly when her arm's down. She wanted a little more athletic look. She works out in the gym, and in the afterwards, can you see now her triceps and her muscles and her deltoids are now showing through? And it's a nice change for her. There's a renewed sense of confidence and just
Are there
spirit.
people, I mean, look, I mean, you're in a unique situation. Women come to you, men and women, and they tell you their insecurities.
Yes.
Arms. It's one of those things that, especially San Diego because of our weather.
Right.
A lot of sleeveless things going on. So a lot of women are bothered by their arms. Because men, we don't have to wear short sleeve stuff.
Men have it easy. Women, if you really look at how short the skirts are, how they wear tank tops, you know, we wear jackets, they have their arms showing, they have their décolleté showing, they have their neck showing. You know, what's interesting is this phenomena with everyone on Facebook and shooting selfies.
Yeah.
I'm having patients say, I have to Photoshop my neck because I can't stand my neck anymore. So I want to just show you an example about what we can do with the neck. So patients like this will often be bothered by a seeming heaviness under their neck. Sometimes it's in combination with the jowls, and so there can be kind of a squarishness to the face. So what I want to do is restore that heart shape to the face by trimming down the jowls. I want to lighten up the load here in the neck. I want to make it nice and clean and skinny. And you know, this patient, all we've done is we've removed a few ounces of fat from under her neck, but she said that she looked probably 30 pounds lighter.
She does. And she looks a lot lighter.
You can just imagine on social media when you just take a selfie and a headshot, you can't really do that otherwise.
For a better selfie, get neck lipo.
That's right.
Is that
yes. And actually,
go ahead.
Oh, I was just going to say, and that's true of the younger generation too. And this is the person that's more likely to be shooting the selfies. She's a gorgeous young woman, and she just wanted to feel more self-confident.
So subtle, but it just really makes her look different.
Lipo is all about subtle but powerful results.
And downtime on that, same thing?
Fast. That area is very fast. Maybe, you know, bruising and swelling for about 7 to 10 days, and then you're off to the races.
Is it, and of course, the double chin doesn't come back once you get.
That's correct.
That out.
That fat is gone permanently.
Is there an advantage to getting it done earlier, like 30s, 40s?
I think so, because the younger you have it done, the more elastic your skin is. And the more elastic your skin is, the tighter and more sculpted the result. And once you get it there, it tends to stay longer.
Okay, so you're doing all, but what about knees?
I do knees all the time.
You do knees?
Yes, particularly the inner surface of the knee. Remember I talked about we want to keep a taper to the thigh. So sometimes we'll narrow the inner and outer thigh, and they'll have a wide knee, and it starts to look like a column or a tree trunk. We don't want that. We want taper. So as we come down to the knee, we'll trim off, sculpt a little bit of that knee fat, and it leaves this elegant taper.
Is it some of the happiest group of patients, by the way?
By far, sure. Liposuction is the #1 procedure performed from an aesthetic standpoint in the United States.
Okay. What should somebody look for in a doctor that's going to do their, in a plastic surgeon that's going to be doing lipo?
Well, I would say you want to make sure that you have clear communication with your doctor, because we want to make sure our goals are well aligned. And we want to make sure that you have good communication and that they care about what your concerns are, and that they're going to be there for you through thick and thin.
So lipo is a big part of what you do.
Absolutely, yeah.
Because some guys, and I think it's important that the public needs to know that most guys don't like to do lipo. And I think it's better to go to somebody that likes to do lipo, because they're probably going to put more into it. What are your thoughts on that? Because you like it. I mean, you told me secretly on our phone conversation, I love lipo. And I said, most guys don't like doing lipo.
Yes, it's a little known fact that I always think of each one of these little liposculptures as a numbered piece, and I want to make sure that before I sign off on them, they're a masterpiece. I want them to look fantastic, and I want to be proud of it, and I want them to be proud of their result.
Is this one of those things where they wish they would have done it years ago?
Absolutely, yeah. I had mine done when I was 35, and I can't tell you how much better I felt when I was at the beach. And you go, definitely, I should have done it 5 years ago.
Now we're out of time, but to the woman that's watching this or the man, and maybe they're worried about lipo, they're worried about surgery, what do you say to them?
I would say that all the old fears are pretty much old myths now, because it can be done safely, quickly, conveniently, with rapid recovery. And if you've always been bothered by that little something or other, whether it be you can't wear this outfit, you can't wear that dress, I can't wear those stretch pants because my thighs look too tight, well, we have a solution to that, and it takes about an hour, and it's gone. It's really that easy.
So transform your life in about an hour.
It's really that easy. But it starts with a phone call and a consult and a shared vision.
Now, are there myths about lipo, like certain things that you hear about lipo that just aren't true, or that drive you crazy?
Yeah, I would say the biggest thing that I hear would be, you know, doctor, I don't want to have lipo because I hear that if I have lipo here, it's going to come back somewhere else. And
isn't that true, though?
if you don't eat it back on, it stays gone.
Okay.
So this is not a replacement for a good healthy lifestyle and watching your calories. It's not an excuse for going and eating as many calories as you want. Those fat cells, though, that we remove are gone forever. But if you eat, you will regain fat where we haven't liposuction. So it's not that it goes somewhere else, you're just getting more fat in a non-liposuctioned area.
Okay, so men, you do the breast, the waist, the abdomen.
Right.
Women, I guess, all areas of their body, their back.
Back,
And,
flanks, arms, chin, jowls, waistline, thighs,
how
knees.
often do you do lipo?
Every
like every week?
Every week.
So you're one of the busiest guys.
Yeah, we love doing it.
Is that right?
Yeah, and I'm really enthused about lipo again with the Vibro Lipo machine, because I can now do under local what I used to be able to do under general, but I can do it better, safer, and faster.
Well, always a pleasure to have you on the show.
Randy,
thank you so much.
Thank you for having me.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.